30 seconds.
Sarah's got a pretty interesting
Well, no, I'll be fine because I've got a computer screen here, so.
No peekaboo.
Well, it's time. We are joined by Dr. Jason Wynberg, director of the DMC Kidney Stone Center, chief of urology at Sinai Grace Hospital. Let me put this down for you. Welcome aboard.
Thank you, folks.
Yeah. So how long have you been dreaming about this moment?
Since I was a child.
Yeah.
Yeah. I mean, there's no finer exam room than what we've got set up right now at 97.1.
Oh, yeah. This is, would you say that this is probably good enough for surgery in here, wouldn't you say?
Beautiful. Just brighten the lights up a little bit.
Yeah.
We're good to go.
It's pretty
Get rid
sterile
of bottle
here.
caps and dust, and we're good to go.
Now, Men's Health Awareness Month is why we're doing this. Explain to the audience why it's very important, especially when you get to the age of 40, to have your prostate checked.
Prostate cancer is the second leading cause of cancer death in men. Approximately 1 in 50 men actually succumb to prostate cancer. So medicine has made great advances in early diagnosis of prostate cancer and treatment. So there's a great benefit in getting checked for prostate cancer.
And how many would you say, how many men per year are diagnosed with prostate cancer?
Over 200,000 men are diagnosed each year with prostate cancer. Now, not all of them die of prostate cancer. In fact, most don't.
Mm-hmm.
But approximately 28 to 30,000 men die each year in the U.S. of prostate cancer.
Is 40 the correct age when you should first start going?
You know, the age has gone up somewhat. We're starting to look at more age 55 to 69 for checking prostate cancer. That being said, there are folks who have a higher risk category, either African American or Caribbean descent, or patients with a family history of prostate cancer. Ultimately, it's a dialogue between a patient and their primary care or their urologist provider to have a conversation about PSA testing.
And obviously, catching it early is the key.
Yep. Catching it early is the key. We do believe strongly that early diagnosis and treatment has reduced the mortality, the death rate from prostate cancer.
And do you find that men are still kind of chicken about this, or they'll put it off, even though they know that they should be getting their exam?
Yeah, going to a urologist is something that men often avoid doing, but they should be aware that urologists are, by and large, friendly guys and women.
You seem like a fine gentleman.
Yeah.
Who we talk about these things. We talk about prostate health. We talk about issues in the bedroom, and it's really just about a conversation. And of course, the primary care physicians as well.
Now, we always find out, it's not this time of year, that urologists, for some reason, are busiest the most the first 2 days of the NCAA tournament. Is that correct? You never heard that before?
Oh, but you're talking about for vasectomy.
Yeah.
Oh, yeah, that's different.
Oh,
'cause
Right.
you can
Well,
put
but still urologist.
laid up at home
Yeah.
watching basketball with snow peas.
Yes,
over.
Right,
exactly.
And do they really swell up to grapefruit size? Is that true? I mean, that's what I've heard. But, so Stoney and I are going to get our exams, not together. I don't know if you're ambidextrous, but we're going to do them separately. Tony Ortiz is going to do our play-by-play, although he is in the
He's in the
age range.
Yes.
He's had one recently. Though.
Yes, I did. I had one a couple of weeks ago with my primary care physician.
I
so.
personally think he's lying.
I am not lying. I've had one every year since 45 because, as
Nice.
Dr. Wynberg mentioned, they had me start a little bit earlier because of my ancestry and because of the history of that in my family.
And you can schedule it at the DMC, 1-888-DMC-2500, or go to their website, www.dmc.org.
Mm-hmm. All right. You want to go first? You want me to go first?
Doesn't make a difference. I'll go first.
All
Okay.
right.
out of the way.
Stoney's
All right.
getting
All
in
right,
there.
Stoney's first.
Which
What do you, any music requests? Do you want to hear some Springsteen?
we still have Highway to the
Thunder
Danger Zone.
Road.
Highway to the
Thunder Road.
The theme song to the Muppet Show. I mean, something along those lines.
All right. We probably should have some music underneath. Oh, I don't want to see this. I do not want to
No,
see
yeah.
Stoney drunk.
Tony is facing Stoney.
Yes,
Stoney-
I am.
Stoney has gone
Well,
into
it would be
the.
best if it would be best if you lean on the exactly.
Yeah, there you go.
Yeah.
That would work,
Get
yes.
close to the microphone.
Lori, get out of here. You're going to be scarred for life if you see this.
Okay. So, Stoney, are your pants down or no?
Not yet.
Not
Okay.
yet, no. I can
Go
see
ahead.
him from here. His
All
pants
right.
are not down.
The trousers are down, and now the tidy they're not whiteys today. They're down.
They're brownies.
Yes, they are.
Yeah,
Whoa!
he's down.
Hallelujah! Whoa, Brent! It's Bobby Love. Oh boy!
Oh, why did I think you were going to sing Moon River? I
Oh.
don't know.
Is that it?
That's it.
That's it. He's done.
That's it. Wow!
That is. All right.
Thank you.
All right, we'll be right back.
Thank you
It's
very
Stoney-
much.
Oh, no,
Oh.
wait.
No.
Wow.
Your
No,
pants
it's
are
Bill's
coming off.
time.
Should he be talking during that? Is that going to give him an accurate reading? He's okay?
Do you have
I
to
gotta
be?
say that was a little more painful than the last one.
Really?
What? Well, maybe
Oh,
you weren't
great.
relaxed enough.
Oh, I was relaxed.
Are you sure?
Yeah, it's
Yeah.
not a big deal.
Should
All right.
you have done some meditation before
I don't know.
Or?
Bill, just be prepared. It's
Oh.
a little.
Well,
it's a little tougher than usual.
It's an
Okay.
important test, but you do have to mentally set yourself up for it.
Yeah.
You do.
Dr. Wynberg, do you usually chat it up with the guys beforehand to kind of get them relaxed or no?
Coming to a urologist, we definitely chat, make sure everything is good and relaxed, and that way folks are comfortable talking about what they're really there for.
Okay.
No offense, Doc. I don't want to talk during the exam. I'm sorry. It's like, no.
But beforehand, to
just
just
far
kind of
too-
Yes.
feel relaxed. I mean-
Yeah, you can talk and it's relaxed, but once the test begins.
All right, Bill, your pants down?
Yeah.
All right,
Yeah,
your
they're
pants are
fine.
down.
Yes, I can see Bill from here.
And
Yeah.
It's just about to happen.
tell us when it's commenced.
I'm done.
No.
And that was it. Yeah.
Are you serious?
That was it.
No, it was nothing.
Wow.
Excuse me while I whip this.
Now, why was Bill so much faster than Stoney?
I'm calmer than him.
I was very calm.
Yeah.
I was talking when it
Well,
happened.
you were singing through it. I don't know if you tightened something up or
I don't
what
know.
happened there, but
Well, the doc, did you
Doc,
notice
where's
a
your wedding
difference?
ring? Where's your wedding ring?
Bill, that was unbelievably
Yeah,
fast.
it's
Not
was
a big
quick.
deal.
It's not.
It's not a
Exactly.
big deal. Hold me.
You were like the
It is
Flash.
not a big
that was
deal.
crazy.
Now, who would you say was the better patient there? I mean, if we're giving out awards.
We don't compare patients. You're both one.
Oh, you sound like
Oh.
Jim Harbaugh.
We love you both.
We
We
got
love you
participation
both.
awards.
Right, we got Harbaugh tomorrow, not comparing thing, and now Dr. Weinberg won't compare anything.
I'm with
Well,
Dr. Weinberg. Don't compare.
I'm
Don't
sorry that you had to do that. I apologize for each of us. Anyone else in the room? Anyone
saw
else
how
want
fast it
to,
was.
Tom?
Yeah.
Oh,
No?
Tom, you sure? I mean, Tom, you're of the age. 42.
All right. Well,
Well,
one
you
Now,
should
now,
start
a question. What about
DMC
women?
2500.
How often should women get them done?
Women see gynecologists.
Yeah, okay. I know.
For issues related to bedroom matters, but they do come see us for other things. So, yeah.
Have
I
you had
love
your
that he's
prostate checked yet lately, Sarah?
Listen, if I had to get done what you normally have to get done, and they bring the duck bill, like that is there's no way
Okay.
I'm doing that in front of other people.
For the
I'm
record,
sorry.
Yeah.
Women go through way
Yes.
Yes.
worse stuff than guys. That is nothing. And if you're over 40, it is so not a big deal to get your prostate checked. Women go through way, way more intense stuff on a yearly basis
Correct,
than guys
yes.
do. It's not even close. You try putting a speculum up there.
No.
That would hurt like hell.
Wow.
Well, both of you were brave
But-
soldiers today. You did a great job, and it was super fast, and it's a very important.
But you
thing.
haven't gotten, now obviously it's different, but you haven't even got you got to get
Yeah,
a
I gotta-
colonoscopy.
I
You
gotta
have
the
to get a
code wrong.
colonoscopy.
I got to get
So
the
do
code
I.
back.
Now for that, I know it's not exactly your department, but it's at 50 and up?
Yeah, I don't want to comment on the guidelines
Okay,
for
sure.
for the colon. It's just not what I do.
Right.
That's
Boy,
fine.
this guy's got all the bases covered.
What about the semicolon?
Wow.
Thank you for coming in. Can someone turn a fan on in here? And,
You could arrange to have a GI doctor come next week.
Oh,
God.
there you go.
no,
But
thanks.
didn't
No.
Katie Kirk did it on TV? You
Yeah,
can
she
do this
did.
on-
That is
Yeah.
correct.
on,
We'd have to be, we'd be out.
You'd have to be
obviously.
out. Correct.
Yeah.
Yeah.
Once again, that's 1-888-DMC-2500 or go to dmc.org and schedule one. Go.
Right.
It's so your general practitioner will do it.
No pun. It's in and out. I mean, you're in and out.
Literally,
Right.
I mean, you didn't even know I had it done.
No, I did. I don't.
It's
Tony, did
so
you even
easy.
see
Yeah,
it?
I
It
saw
was so
from
fast.
my angle, I could see it when it happened, and then boom, it was done.
That's
Yeah.
it.
We get the reverse angle on the
No.
website, 971ticket.com.
So it's that easy. Well, thank you for coming in, Doctor.
Thanks for having me.
Thank you
We
very much.
appreciate it big time. And it's that easy.
It was fine.
I just
Yeah.
don't want to sit down right now.
I'm sitting down and it's okay.
It's
Do
all
you
right.
feel
yeah,
greasy?
it's okay.
Well, because you've got
Yeah.
you
Stuff,
have to
yeah.
Right.
got to lube you up.
Right.
You got to use the abbreviation for Kentucky in there. And, I feel like you got it down. It's still there. Hold on, let me just take a seat.
All I
Are you
know
sure
is all I know is I've seen a new side of my coworkers that I hadn't seen before.
Yeah, I think you were almost stunned because
That's a
you
bubble.
didn't speak. You
No.
were just staring at them while this was happening.
It's weird to see it from this angle. I'm used to seeing it from the other angle when it's happening to me. So seeing it from this angle it was unique.
Yeah.
Now
It
you
was
saw
different.
us head on.
Yes, I did.
Can you? It's like an elevator button I'm dealing with down there. That's,
I didn't look that hard. Thank you, Bill.
I.
Yeah.
There's no way. Well, anyway, play on words. Thank you, DMC, for coming in.
Awesome. That went really well.
Thank you guys. I got the jelly in there. Thank you very much. So, are we okay? Should we get?
Yeah, you're both good.
Oh, we're good.
Okay, good. All right. Awesome.
Thank you. Appreciate
Thank you so
it.
much.
Doc, nice to
Thank
meet you.
Thank you guys.
Thank you.
Thank you very much.
Thank you so much.